What topic is no one talking about now that historians will study in the future?
It's the insanity of the mental health industry that is destroying the mental health of America, making diagnoses based on symptom clusters with no biological data, then drugging people. Last year, there were 337 million prescriptions for antidepressants. 27% of all doctor visits, no matter the specialty, 27% someone's leaving with a prescription for a benzodiazepine like Xanax or Valium. This is an insane time. And they call me crazy, and I'm not crazy. They're going to be talking about this dark period in psychiatry for centuries to come.
Psychiatry in all of this time doesn't have one case report of one disease validated, not one. What they do is they meet at the American Psychiatric Association. They meet in the DSM committee, Diagnostic Statistical Manual Committee, and they vote on making new behavioral and emotional disorders, and they vote, and then they start immediately calling them diseases. And they tell people, they tell the public these are diseases. Total fraud. Total fraud.
The actual truth about chemical balance is that it's an actual lie. Nobody has yet measured, demonstrated, or created a test to show that somebody has a chemical imbalance in their brain. Period.
What the American public should be thinking about is when they or their loved ones or their friends have received a psychiatric diagnosis, they should be asking the doc, geez doc, where's the chemical test for that? Where is the objective test for this? And I guarantee you that they'll be told, we don't have a chemical test for that.
There are no biological tests for any mental illnesses that I'm aware of.
There are not current available tests to verify your diagnosis.
There is no test. There is no specific test to differentiate between, let's say, schizophrenia and bipolar disorder. Not a single test.
Yeah, we have not really confirmatory test for the diagnosis.
There is no test, there's no biopsy you can do that says this person is depressed, this person is bipolar.
We don't have anything really currently to identify mental illness per se.
No, there are no specific tests to confirm the diagnosis or show the improvement, like any blood tests or any x-rays or anything like that.
Oh, in my practice I don't do any tests. I just speak with people and listen to them, and then I make a decision in what kind of illness there should be.
We don't really have any specific blood tests or other tests that are definitive for any mental illness whatsoever.
What kind of biological tests do we have available today for detecting mental illnesses?
None.
There is no rational science behind what they think is the cause of these symptoms. The medications that are being given to people are, without exception, introducing chemicals that are altering the brain in ways which can be very damaging. And I'll go a step further and say that in the absence of a proven chemical imbalance for which the medications are, quote, rebalancing or fixing, the medications are in fact toxic.
How many patients have you been able to cure so far?
I would say one.
How many people have I cured? Well, there are no real cures right now in psychiatry.
The idea of you asked me about the issue about how many people I've cured. I don't know that any of us are ever completely cured of anything.
I have not been able to cure many patients.
I have cured none of my patients.
So you have to ask the classic Roman question, legal question, cui bono, who benefits? The people who make the diagnosis.
There's not one double-blind study that proves that mental health conditions, including depression, is a chemical imbalance in the brain. In fact, they don't even know how to measure the serotonin in the brain. Yet they're using serotonin reuptake inhibitors for PTSD, for major depression. They're using it for everything. Why? Because it numbs the third eye. And it actually causes a chemical imbalance. And that's why it's so hard for people to get off after they've been on it for a long time, because it literally causes a chemical imbalance which numbs the third eye, which shuts down the second chakra, the sexual center, and that's why 70% of people have sexual dysfunction. So there's not one double-blind study that hasn't been sponsored or manipulated by Big Parmesan cheese that proves this, yet the whole industry of psychiatry is based on this thesis. And so how is this circulated into modern day humanity? Well, they spend lots of money studying psychology in humans, and they drop human beings into alpha brainwaves where they're suggestible, and they drop in these commercials and on magazines and television programming showing people who are happy running around with their children, and they're on this Prozac or Lexapro, when in all reality, if you're sitting in the psychiatrist's office like I was, sitting across from the world's problems, yes, for a moment these medications can numb them, but they come back 3, 4, 5 months later and it stops working, and they give you more medications, and it's not treating the root cause. So it's not true. There is not one double-blind study that shows that this is the cause. The real cause is a disconnection from the psyche, which the word psychiatry comes from, which is ironic because the entire Western mental health system has been designed to cut someone off from the soul, which is the 4th, 5th, and 6th dimensional self, and they're treating human beings like a desk, like a table, like a mechanical system, where if you adjust the serotonin, that it's isolated in a system, but it's not. It's all interconnected. And this is what led psychiatrists, this belief, which is what led to, locking people up in these mental health institutions, treating them like prisoners and putting them on mind-numbing meds and shocking their brain with electroconvulsive therapy. They don't even know what they're doing. So the truth will set us free, and the truth is that we have a soul, and a disconnection from the soul. There is only one disease, a disconnection from the superconscious mind, Freud called it, which is the 4th, 5th, and 6th stranded DNA, which will deliver to your mental 3D mind the right thoughts, words, attitudes, and beliefs, which will then communicate with the emotional dimension 2 body to the dimension 1 physical body, which will code for proteins, the double-stranded helix, in accordance with the frequency, thoughts, words, beliefs, and attitudes from your soul, your superconscious mind. And that is the cure, reconnection to your soul.
When I worked for the drug industry, science was completely abandoned. These drug companies that I was interviewing with had no problem telling me, look, we design drugs based on treating symptoms. We don't cure. That's a business model, okay, that allows you to give a drug to a person for life. The next level of drug advertising is inventing disease. When you run out of symptoms, you don't have any more clientele. With psychiatric medications, you can invent diseases all day long. There's 2 words that a psychiatrist fears. Prove it. And if the doctor can't do it, 9 times out of 10 they can't, then don't take the drug. I wondered, as a chemist, I'm making these drugs, they're proving deadly in our labs, and they're proving deadly in other labs, dangerous, ineffective. How are they selling them? Big Pharma has the best marketing department in the world. Geniuses. You simply pay to report that the study showed positive results. You're paying them. You're buying science. At least 125,000 people dying every year from prescription drugs. You would think that you'd spend more in research to try to offset the death toll. No. Keep going with marketing. Market, market, market. Hypnotize them and drug them. And get them into their psychiatrist so they can swallow the next Cymbalta or the next Prozac, or whatever they're going to package it as and name it as.
Naturopathic physicians are trained in healthcare. MDs don't practice medicine. They practice allopathic medicine. And allopathic medicine is fantastic for trauma care, surgery when it's necessary, childbirth, dentistry, things that are reductionistic in nature. But when it comes to treating chronic illnesses, things that most people go to the doctor for most of the time, MD-directed allopathic medicine, it's a failed methodology. Because the medical doctors, in point of fact, your medical doctor may be the nicest person that God ever created, but your medical doctor is not trained in health care. Your medical doctor is trained in disease management. So the heartburn is never cured, it's managed. The blood pressure is never cured, it's managed. The depression, the anxiety, the blood sugar abnormality, the fibromyalgia, the arthritis, the asthma is never cured. These things are all managed. And as time goes by, patients under allopathic MD pharmaceutical care get weaker and more dependent on drugs and surgery and sicker as time goes by.